Hello and good evening, everyone. Welcome to the very last and final episode of our webinar series, Demystifying Residency, The Path Ahead. My name is Anne Georgie, and I'm the National Officer of Marketing and Sponsorship for AMSA for today. In today's session, we are going to break down USMLE exam pattern based on statistics from previous papers, and we'll talk about how Kaplan can help. Before we start our very last session today, I want to once again remind everyone who's joining us on Zoom to follow some general pointers. As you join the call, please put your microphones on mute, switch off your videos, and do not share your screen. This way we can continue the webinar without any disruption. Sir, I would also like to request that you turn off annotations while you share your screen. And now I would like to welcome our speaker, Mr. Abhishek Bhavdankar. Good evening, sir.
Hi.
Good evening, sir.
Yeah, good evening.
He is the national head of Kaplan Logicquest, a premier institute for prep and guidance in India. He has been the head of the Indian division for over a decade and has helped thousands of medical students pass their USMLE and secure a residency in the US. Thank you so much, sir, for taking the time out of your busy schedule to be here with us and answer all of our queries. Okay, so we have received all your queries and we have looked through all your emails to carefully compile a list of your questions for today's webinar. Thank you to all our viewers for your participation and your interest. So without further ado, shall we start the session, sir?
Absolutely.
Okay. Now, for the very last time, I'll be starting off with our first question. So I think this question is something which is on a lot of IMG's mind. The question is, when an IMG applies for residency in the US, are they given equal preference to US medical graduates? And does having a green card or citizenship help give you an advantage? Can you share some statistics, sir, based on previous year's papers?
Well, first of all, thank you so much for the question, and it's a very special moment for me because I'm just sharing the screen with you for the last time on this particular series. So since today's topic is an overview of USMLE, we are also going to talk about some previous year statistics as you had requested. I have some statistics to share with you. If you can just just enable me to share my screen. Looks like host.
Yes, sir.
Yeah. Great. So first thing first, what I would like to bring to everyone's notice, there's a misconception amongst the IMGs.
Sir. Would you mind turning off annotations before we start, just to avoid any disruptions in the future?
Yes.
Thank you, sir.
Great. I hope it's done now.
Yeah, I think so.
Okay. So first thing first is, it is very important for students, especially the international medical graduates, to know and understand that when it comes to the, Indian students or any Asian or international students applying to the US, right? People think that, because we are Indians, we are Asians, we will not get that preference. And as a result of which, they take a back foot, they take a back step. It is very important for us to know that how the statistics have been in the last few years. How is it that people have been able to, get an admit or a seat or a spot in the US? It is very important, and which is why I would want to bring to your notice. Now, if you check your screen, on your screen, it is clearly mentioned. I would like to share with you last 5 to 6 years of statistics, so it becomes a historical data for us in order to, come to a conclusion whether it's not by fluke, but yes, it actually works in the IMG's preference. So if you see that in the year 2015 on the left of your screen, it clearly mentions that in the year 2015, there was a total of 41,334 registered applicants who had applied for the residency in the US. And in the same year, the total number of positions which were offered by the US universities was about 30,212, right? Now, that's fine. But it also says that from a year 2014 to 2015, when I'm comparing, there's a rise of 940 total number of applicants and a rise of 541 total number of seats or positions which were
Wow.
also offered by the US universities. Okay.
I see.
Now this means that from a 14 to a 15, there has been some awareness. People have taken a step ahead to get into the US, and as a result of which, the demand and the supply both have
Mm-hmm.
increased in the upward direction. Now, what happened thereafter? When in the year 2016, when people did apply for residency in the US, the total number of registered applicants now increased by 1,036 total number of registered applicants. So, which means the registered applicants from 14 to 15 and 15 to 16 have increased, which
Mm-hmm.
shows that yes, there is a lot of demand for Indian students or Asian students or international
Mm-hmm.
students, I would say, to get into the US, and even the US has accepted them. Now, if I have to see the year 2016, what has been the total upgradation of total number of students? So the PGY1 positions, which stands for the postgraduate year one positions, increased by 567 total number of seats. So which means, okay, fine, 14 to a 15, 15 to a 16, there has been a rise. Now, vis-a-vis, if I have to give an Indian example, in India, the total number of seats are stagnant, but the total number of applicants are increasing day by day, year on year. People who've graduated this year are also applying. People who could not make it last year are also adding up to it, and last to last year are also adding up to it. So you can just imagine the stagnancy which is there in India, and the way we are getting up in the US as well. Now, when I compare the 16 to the 17 statistics, I can also say that a total of 787 total number of registered applicants increased in comparison with 16 to a 17, and an all-time high 989 total number of PGY1 positions increased in the year 2017. So seats are equally increasing in the US. That is the biggest punchline over here. So we know that yes, there are a lot of opportunities which are multiplying in the US as of now. This was until 2017. If I have to just walk you through the 2018 statistics, on the
Mm-hmm.
ECFU's official website, it is clearly mentioned that in the year 2018, the first year residency positions was 56.5% up from 53.3 last year, which
Mm-hmm.
means again in the year 2018 also the statistics went up. Now what happened in 19? The same statistics, now it says that success rate in obtaining first year residency positions was 58.8% up from 56.5 last year, right? So again in 2019, last year, it increased equally. So from a 14 to a 19, last 5 to 6 years, if I have to say, it has been increasing, and not a single year that it has dipped, which is the best sign. Now you must be equally excited to know what happened in the year 2020, when
Yeah.
on the third Friday of March the results were out, right? Match Day adds 7,000 graduates to the USGME program. And if I have to just read out a couple of lines, which actually gives us the hint, more than 7,000 international medical graduates obtained first year residency positions in the US programs of graduate medical education, according to the results of 2020. On 1st July, these physicians were scheduled to join teaching hospitals across the nation, where they will engage in medical specialty training and provide supervised patient care. Now, at the bottom of the screen, you can see 61% of the IMG applicants were selected by the US GME programs in the highly competitive match process, the highest IMG match rate in the last 30 years.
Wow.
If you see from a 14 to a 20, this has been the upward movement of the graph when it comes to the international students getting into the US. Many times people come back to me, so you know what, I'm interested in getting into the US, but Indian students don't get through, right? So they don't give seats to Indian students. So the one point that I want to make here is it's all about you. It's all about the the profile that you carry and what is the value add that you carry with you. It's not about you being an Indian. So the nationality and racism and all of those and casteism and religionism comes later. First is you and what are the value add that you are carrying with you. That's what really matters. And coming back to your question, I really don't see any kind of difference, because the statistics says it all that IMGs definitely do have a lot of value. If I refer to the webinar series part 1, I had specifically shared that 26.3% of the IMG category students are international graduates. So if more than one quarter is outsiders, I guess
Right.
our viewers should just eliminate this fear from their mind that
Mhm.
Indian Asians or international students will not have any chance. Yes, they are definitely topping the charts, is what I would say. Additionally, if I have to also share the historical data in the last 10 years, this has been the gradual improvement of the non-US and the US IMGs, because I believe you were also curious to know about the green card holders. So green card holders
Mhm.
are the US IMGs, which is on the left side of the screen, and on the right hand side, those are the non-US IMGs. Apparently, if you see in the year 2010, there was a vast gap between the US IMGs and the non-US IMGs, whereas it was 47.3 and 39.8. So then
Right.
US IMGs had a weightage over the non-US IMGs, but things have changed drastically in the last 10 years. Today, the non-US
Mhm.
IMGs supersede the US IMGs. So definitely there is a lot of scope, and if you just analyze this data well, you know where I'm coming from.
Okay, thank you, sir, so much for compiling all of these really useful statistics for us and taking the time to give us your advice. I think what we should all take away from this is that if you're an IMG and you want to go to the US, there's no reason why you should hesitate to apply. So
Correct.
let's move on to our second question, which is, what is the USMLE Step 1 exam format?
So, talking about the USMLE exam step 1 pattern, it could be slightly different from your existing MBBS pattern on curriculum. Let's have a look. So, this is exactly how the step 1 basic sciences exam deals with. So, it deals with the application of the basic sciences that you have dealt in the first year and second year, or if there are some juniors who are attending right now who are currently dealing in the first year and second year subjects. So you'll have 7 subjects, which is an anat, physio, biochem, patho, micropharmac, and behavioral science. So these 7 subjects put together makes a USMLE step 1. Don't worry, there is no FMT, so you can be rest assured. Right? I know it's like a nightmare for most of them. You can take this exam anytime after the second year of medical school, which means that
Yeah.
when you step into the third year, you are eligible to appear for the USMLE step 1, right? The high yield topics out of these 7 subjects are the patho, pharm, and
Mhm.
physio, which are the 3 Ps. Focus on these 3, I guess you're in good shape, right? But that does not give you a leeway of just studying these and just
Mhm.
leaving those. You study for all, but these should be your high yield subjects. It's an MCQ based pattern with the 280 questions divided into 7 blocks of 40 questions or 40 items each. So 7 for the 28, 280 questions is what step 1 would deal with, right? The minimum passing out of
Right.
80 is 194, and the exam fee is $1,125. So that's roughly around 80 odd thousand rupees. It's an expensive deal, so we do not want to waste our attempts, right? If you fail, then you can reattempt, but if you've passed, then you
Right.
can reappear for the next 7 years. The average handling time is about 85 to
Mhm.
90 seconds, and all the question types or pattern is a clinical vignette format, where we're aloof from when it comes to our MBBS pattern, right? Now,
Right.
the pattern which you can see on the screen is as of today, or rather which is valid for the next 1.5 year till the end of December 31st 2021, I would say,
Mhm.
because as you must have heard that from 2022 January, the pass fail system would come into the picture. Well, we do not have any updates if the total number of questions are going to change. However,
Right.
this is definitely the minimum score of 194 that will just rule out, because then it's going to be either a pass or a fail. And if you fail, you can't reattempt, but if you pass, then you cannot reappear. So again, once you've passed, is passed. So again, that would not play a major role, is what I personally feel. So that's all about your USMLE step 1. The exam is conducted 365 days in one of your nearest prometric center. Which are the prometric
Mhm.
centers we have seen in the previous session? There are like 8 centers. So you can just go to these exams 365 days. You don't have to wait for a particular day. Of course, 365 minus the Sundays and minus the national holidays. So that's how
Right.
frequently the USMLE exam is conducted. If you want to know micro details, the timing is 8 to 4. 8 o'clock in the morning it
Okay.
starts, right until
Yeah.
4 in the evening. One shot, you sit for 8 long hours. Yeah, that's about step one.
Okay, thank you, sir, so much for answering this question in so much detail. I think this gives everyone a really good idea about the USMLE Step 1 and what we need to know about it. So our next question is again about the Step 1, and someone has asked, can you show us a sample question from the USMLE Step 1?
Sure. So now, when I'm sharing the sample question with you, all I want you to do is, back of your mind, just correlate these type of questions with your daily MBBS question pattern,
Mhm,
and then you would
mhm.
understand what kind of superficial level that MBBS teaches you versus what USMLE expects you to study in depth and to what an extent, right? So this
Right.
is the sample question of USMLE. I mean, this is just a case, I would say. I'm just presenting a case to you, right?
Okay, I want all our viewers who are with us right now on Zoom and on YouTube to please pay attention because we will be asking you guys for your answers to this question. So continue, sir.
Yes. So again, when I'm discussing sample questions,
Mhm.
some kind of inputs or answers would be appreciated. So then we know whether you're on the right track and are you able to answer these kind of questions. That is
Right.
important. So here we're talking about a case right now, right? I've not yet come to the USMLE question, but this is just a case. So the question is, first thing first, try and understand your patient well. That's the first thumb rule of USMLE. So how do you note and understand your patient case? 22-year-old male, fine, I've
Mhm.
understood. Fever, fair enough. Past 2 weeks, fair enough. He's got productive cough, fair enough. I've got that, I've made a note of it. Shortness of breath as well, okay?
Mhm.
Patient also reports weight loss and past history of epilepsy. Now, before we proceed, can you just, maybe in your Zoom comments or YouTube comments, would you want to answer this question as to what case are we referring to? Anyone?
Okay, guys, let's ask our viewers. Do you guys have any idea? Okay. Okay. Well, while we're waiting for those answers, I think for me, looking at this question, this patient has a fever, so that would suggest something infective. For 2 weeks, something chronic, then productive cough and weight loss. So all of this to me is suggestive of tuberculosis. So
Mhm.
let's see if our people on Zoom chat agree with this.
Great. So that was quite smart of you and to, come to the point. But the
Mm-hmm.
point I'm trying to make here is, looking at this, you could immediately come to a particular conclusion that this is a tuberculosis patient that we are referring to, right?
Mm-hmm.
But the
Oh,
question,
one person has submitted, they think it's a parasite.
okay,
Someone else has said pneumonia.
mm-hmm. Okay,
Okay. Yeah.
fair enough.
Continue, sir.
Fair enough. Irrespective of this, my only point I'm trying to make is, irrespective of
Mm-hmm.
pneumonia or tuberculosis,
Mm-hmm.
one thing you have to know and understand. Can USMLE question be this easy that the moment you have a sight at it and there's a, oh, it's tuberculosis, right? So that's
Right.
not the USMLE question.
Mm-hmm.
If I have to ask and twist, the question could be like this. And now what could be the answer here?
What is the causative organism? Okay, I'll ask the person who said a parasitic infestation to be specific. If it's tuberculosis, that's Mycobacterium tuberculosis.
All right.
Pneumonia.
Mhm.
Whoever said pneumonia, if you want some
Okay.
answers, the Zoom chat.
Okay. Fair enough. See, again, that's exactly where I'm trying to pinpoint. The moment you had a look at this, immediately first, it took you a few
Mm-hmm.
seconds to understand that it is a tuberculosis patient. And then within a fraction of a second, you could say
Mm-hmm.
it's a myco-TB, right?
Mm-hmm.
But then this cannot be the USMLE question. The real USMLE
Right.
question is this: which of the following is the characteristic of the causative organism? Now, what would you
Mm-hmm.
say?
Okay, let's ask our viewers, what do you guys think?
Which of the following is the characteristic of the causative organism? And if you expect me to open up the answer choices, that's not going to happen because I need to know what you know, right? Again, the agenda is not
Mm-hmm.
to test you on this, but the agenda is to know how you think and how differently you think and what are the mistakes that you possibly could make which USMLE doesn't expect you to. Now, whatever mistakes you want to make it here right now on this platform. Because from today onwards, there's no scope for you to make a mistake. Whatever mistakes, make it here. That's fine. So any
Mm-hmm.
answers?
Okay, so yeah, someone has said acid fast bacilli,
Mm-hmm.
and let's see, I'm YouTube also. Okay, some people have said, is it tuberculosis?
Mm-hmm.
Okay, which is not the question at hand. Let me see. Uh, okay, if you were to ask me, I would say it's a slow-growing organism. They form rough, tough colonies. That's something which they teach us. Um,
Fine.
what else? Anyone else? Gram-positive bacilli. That's what people are saying. Okay.
So
People are saying acid-fast bacilli.
correct. So
Again.
AFBs and gram positives and gram negatives are quite obvious options that anyone would give at this point in time, right? But the real options for this
Right.
question do not really exist. The options that you have on your screen are these. It produces an endotoxin, it produces an exotoxin, produces a coagulation enzyme, and produces a heat-sensitive catalase. Now, these are your answer choices. Your AFP is gone, and
Right.
so are your other choices, like gram negative and
Yeah.
positive. These are like gone.
Yeah. So
Now,
I see where this is a
now that you
challenge.
have these four choices, now what do you think
Mm-hmm.
are your choices, or what's one thing that you would want to point at?
We've got a couple of answers from our Zoom chat. People are saying A, it's an endotoxin.
Mm-hmm.
And I think I agree with that also, A, endotoxin.
You
Someone else has said B, it's an exotoxin. So
okay?
it looks like people are debating between is it an endotoxin or
Okay.
exotoxin right now.
So the choice is between, or the flip, or the toss is between A and B, whereas the
Mm-hmm.
actual answer is D. It produces a heat-sensitive catalase because it gets inactivated at 66 degrees Fahrenheit.
Oh wow! Now someone has said D, right? But yeah, wow, that's a pretty tough question.
Correct.
I didn't know this was the answer. Yeah.
So the point is again what I just said. I'm just repeating that. At the MBBS level, we are just reading very superficially, and USMLE really wants you to get down to the root level for you guys to know
Mm-hmm.
how the question or the case has to be studied in what particular format, right? So
Right.
that is about it. Now, if you're since you're asking me some questions, I would just want to present a couple of questions. Maybe if that helps you to know and understand how different is it from your USMLE questions. Now,
Mm-hmm.
this particular question looks very complex, yet, yet it's the most simplest of the lot, right? So, and would you want to read the question or you want me to read the
Mm-hmm.
question?
Sure, I can read the question. In order to determine the location of the hex A gene, somatic cell hybrids and human cells were produced.
Mhm.
The presence or the absence of the hex A gene was determined by southern blotting the DNA from the hybrids with a probe specific for the genes. The data is summarized in the table above. Pluses and minuses below each of the chromosome numbers denotes the presence or absence of that chromosome from the indicated hybrid. On which chromosome is the gene for hex A found?
Did you understand the question in first place? Or did you had this kind of a feeling in your in your mind,
I
right?
think it's more like that kind of a feeling. Yeah.
Correct.
Yeah.
Correct. So the point that I'm trying to make here is the questions which always look complex need not be complex. That's the hidden clue over here. It's one of the most simplest example or a question which I could discuss here on this platform, because in this particular question you do not have to think from a physician's perspective. All you need to do, the uh, the tip that I can give you at this point in time is, if you've not understood a question ever, during the USMLEs, all you got to do is just simply hit on the actual core question. So the core question is, on which chromosome is the gene for the hex A found? That's all I need to do. So on my left side, you can see there's a hex A gene, which is like a plus minus plus minus minus plus plus. And all I'm expected to do in this particular question is find a replica of these on one of these 23 chromosomes, right? So I can find a
Right.
replica of this on chromosome number 15, and that becomes my answer.
Right.
Right?
By
Nowhere
the way,
I
I just
do.
want to congratulate 2-3 people on Zoom had guessed 15 as well. So congratulations to you guys for getting the right answer.
Great, great. Good luck. Thanks. So it's not always that difficult, the moment we have a look at that. So this is how we will have to tackle the questions properly in the stipulated time. So it's complex, but yet it's simple, right?
Right.
So this is it. If I have to discuss with you the next question type, I would say, now this kind of a question, typically we have seen students looking at this, it looks quite tough for them to go ahead and answer. If, for example, after an accident at work resulting in severe hemorrhage, a machinist is rushed to the ER, which of the following sets of autonomic responses would be predicted in this patient? Now, usually what students make a mistake is, okay, fine. Heart rate decreased, bowel sounds decreased, constricted pupil diameter, I don't think so. Then decrease heart rate, increase. Will this decrease? Like this, we need to understand the clock is ticking. We just have about 85 to 90 seconds in this particular case. So we have to ensure that you are just going as quick as you can. So here you need to follow the process of elimination. Okay, so in this particular thing, it always works from the component that you best know. So in this case, if I were you, I would have definitely started with the heart rate. Now, if I have just used the hemostatus, the first thing that I would try and understand is, okay, fine, heart rate. There's a lot of blood loss. Heart rate. What happens to my heart rate? Increase or decrease?
Increase.
It will increase.
Right, everyone. Let's ask everyone on Zoom. What do you think? Heart rate will increase or decrease? Okay, I say heart rate is increased.
Increase, absolutely. So what we would do in this case is simply eliminate the unwanted ones, right? So automatically all those who says that heart rate would decrease, I will strike them off, right? Then what happens to the bowel sounds? Will it increase or will it decrease?
Okay, guys, what do you think? By the way, everyone who has responded also said heart rate would increase. So good job, guys. What about bowel sounds? Increased or decreased? Okay, most people are saying decreased.
Bowel sounds would decrease?
That's what the chat says, yeah.
Which means the G and H would be eliminated, right?
Right, good job, guys.
Right, now we're talking about pupil diameter. Will it be constricted or dilated?
Okay, what do you guys think? Will pupil diameter be constricted or dilated? Dilated. People are saying dilated.
Right? So we eliminate the unwanted ones, and that's how you come to a particular conclusion. If you can just put up some small strategy, I guess you can come to a point rather than just saying and then come back to the answer, go back to the question, come back to the answer choice, go back to the question, come back to choice number B, come back to choice number C. This is going to unnecessarily waste a lot of your time. So you got to be very smart in this particular type of questions. This kind of strategy actually helps, right? And the next type of question. Okay, it's a very simple question type, right? And for your audience, would you want to read it out?
Yes. Okay, everyone, pay attention, and I expect answers from all of you in our Zoom chat. And everyone who's listening on YouTube as well, please send in your answers. Even if you're wrong, that's okay. This is a safe place. Just give your best answer, and we'll all try to participate as much as we can. Okay, the question is, a 6 centimeter length of rectosigmoid colon containing a 2 centimeter diameter sessile polyp is surgically removed. On sectioning, the lesion shows finger-like like papillae with scant lamina propria. The surfaces of the papillae are covered by dysplastic columnar epithelium with considerable nuclear pleomorphism. No glandular structures are seen in the base of the lesion or the adjacent muscle tissue. The margins of the specimen are free of dysplastic epithelium. What further therapy does this person most likely require? Now I'll read out the answers. Guys, please put in your answers on the Zoom chat. The options are A, adjunct chemo, B, complete colectomy, C, no further therapy is required, D, radiation therapy, or E, resection of regional lymph nodes.
Let's wait for some answers.
Let's wait for some answers.
Well,
Okay.
I would just like to, give some hints over here. While you're, dealing with this kind of question, first thing first, understand, are we talking about, is this a cancerous or a non-cancerous? And then you start, thinking about it. Like, for example, sentence 2 really gives us the diagnosis, which is bilious adenoma. Now just look out for the following options and then see whether it is, are you able to, get to the answer or not?
Okay, people have picked A, E, C, D, and E. So I guess everyone has decided the answer is not B, but there are questions, there are answers for all the other options.
Okay, so first of all, the last line says that the margins of,
Someone has said this is a hard question. Yes.
Okay. So what are the answer choices, if I may know?
People have said A, C, D, and E.
Okay. Yeah. So there's everything.
There's everything except for D. Yeah, people. I think this one is a tough one. People are a little bit confused.
The margins of the specimen are free of dysplastic epithelium. Think about it.
Okay.
Now I've given you a hint.
Okay, now we've got one answer from YouTube. Someone has said the answer is D, radiotherapy.
Okay. When I'm saying the margins of specimen are free of dysplastic epithelium, which means it isn't a true cancer, right? So if it is free of dysplastic epithelium, obviously there's no further radiation which is required. Why would you radiate the patient when it is free? Right? So the bottom line question, the best way to, what I would say is attack this question is search for the keyword. And in this entire question, there's one keyword which I know, which I found out, is it's free of, right? Now, nowhere is going to be underlined or bold or red or something to give you an indication that, boss, it is free of, free of, free of. So which means it is like, it's no further radiation is required.
Right.
Your job to know what exactly is being asked in this particular question. Right,
that makes sense. Yeah.
So that is the hint over here. Identify your keywords, and this will happen, my friends, only through the practice. I can challenge you on this. Practice is the only key here. Even if you just try to mug 1,000 questions, it's not going to happen. You will goof up on the 1,001 question. But if you've had a proper practice, then okay, fine, such kind of questions, usually find this area and then you get the answer. That's how you'll be able to come into the flow. So that's about the bottom line question, right? I guess, yeah, so far these many questions is what I would want to discuss. Otherwise it's going to be an endless evening.
Okay, thank you, sir, and thank you to everyone who had said that the answer is C. Good job guessing the right answer. This was a really tough question. According to me, I found it very tough. So good job, everyone. So, sir, shall we move on to the next question, or is there any more tips and strategies you'd like to add for this?
I guess, yeah, that should be it. So again, look out for keywords. That's the punchline over here. Yeah.
Right. Thank you, sir. So our next question is, what is the format of the USMLE Step 2 CK?
Okay. As far as the step to CK question is concerned, also the paper format is concerned, it is very much similar to your current step one pattern. So even if you just go ahead and compare your step one with the step two CK, you'll be good to go. So step one is all about understanding the basic sciences. Step two CK is all about understanding the clinical sciences. Step one has 7 subjects. Step two CK has just 5 subjects. So there are going to be 2 subjects less than your step one, which is why in the webinar 3 we spoke about step one preparation taking about 9 to 12 months, step two CK taking about 4 to 6 months. Reason being 2 subjects less, plus these you're going to do during the final year or the internship year. So since you've done these thoroughly, it becomes easy for you to correlate, which is why it takes lesser time. So your 5 subjects are going to be internal medicine, pediatrics, psychiatry, OBGYN, and surgery. The high yield topics in your step 2 CK is your medicine, which is 60% or more. And which were the high yield subjects in step 1 that we saw?
The 3 Ps,
3 P.
pathology,
Absolutely,
physio.
absolutely correct. Absolutely correct. So this is how you compare your step 1 with your step 2 CK. Second is MCQ based pattern. We had about 280 questions there. We have 118 questions here. Step 1 was a 7-hour long exam plus 1 hour break. That's about an 8 hour. This is 8-hour long exam plus 1 hour. That's about a 9-hour long exam. The minimum passing in step 1 that we saw was 194, whereas in step 2 CK is 209. And exam fee in step 1 that we saw was $1125. Here is $1145, just about a $20 more, and that covers your entire step 2 CK. There's nothing much beyond this.
Right. That makes sense.
The rules would
Thank
remain
you,
the
sir.
same. The rules would remain the same for both. Go to the Prometric Center, 365 days. It is administered anytime you go, and just appear for the exam.
Okay, thank you, sir, so much for giving us this insight. So there's a follow-up question to this, which is, can you show us a sample question of the step 2 CK exam?
Oh, sure. So I would not like to present a fresh question. It's good to have the same case so that you can correlate how the question would change between a step 1 and a step 2 CK. So the same tuberculosis patient that we saw in the step 1, right now presents to the doctor for the step 2 CK this time, and the question changes: which of the following test is the most sensitive for this patient's condition?
Okay, so all of you guys on Zoom and on YouTube, the question is, which of the following test is the most sensitive? Please send in your answers on chat. Okay, so again, we don't get options for this, or?
I'm very mean. I would
Okay,
not.
so someone has said the tuberculin test is the most sensitive. Someone else had said PCR. I think I agree with them that PCR is the most sensitive test. Any other answer? Someone has said an assay. Okay. Before nothing. Someone has said gene expert. Okay, what else? Someone has said culture. Yeah.
Now let's see whether these are the answer choices.
Okay, people are saying the PPD test. What else? Okay, let's see. I think someone has said assay already out of these. Someone said culture. Okay, no one has said staining. So I think now we're deciding between B, C, and D based on answers. Okay. So those are the answers we have so far. PPD test, the assay, and the sputum culture.
Okay, so the three of those. Okay, again, point here, I would want to come back to the same point again. Find out the keyword. The keyword, for the sake of our discussion, is purposely highlighted in red and bold, which says most sensitive. Right? Now, when it says most sensitive, the answer obviously will have a different turn or a shape of its own, altogether. So if we're talking about the most sensitive, automatically the answer would be sputum culture, right?
Right.
If the question had been what would you do first, maybe chest X-ray, which is the
Right.
most important, then it would be PPDs. Now, someone also said serum interferon gamma release assay, right? I don't know why, but if you're making this kind of a, I would say mistake, but like kind of, a glitch error here and there. Again, I would want to give you an input here. Please tell me, especially the person who's given the answer of essay, is this a case of active TB or a latent TB?
Right. So if the person who answered that could put that in the chat, what do you think? A case of active or passive TB? Okay, someone has said a case of active TB.
So assay will come in active or latent?
Okay, that's the follow-up question. Will assay come in active or latent? Someone has said latent.
Which is why assay is not the answer.
Right.
Right? So it's just don't go by the answer choices, understand your patient well, which is why we had underlined the patient with some typical keywords. So when you know what kind of case it is, then you can also correlate your answer choices accordingly, depending on the case which is presented to you, right?
Right.
Now. So yeah, that's the sample question of step 2 CK.
Okay, thank you so much, sir, for that question and sharing your insight with us. Let's move on to the next question. The next question is, can you tell us about the USMLE Step 2 CS pattern?
Okay. As far as the Step 2 CS is concerned, you need to understand that this exam, as of now, is conducted in a live setting where on the right hand of the screen, you can see in image number 2, there's a patient and doctor interaction. You will be assigned 12 simulated standardized patients who are professionally trained theater actors, right? Now, these patients are trained to that an extent where they would know medicine more than what you would know. So do not take them for granted that, okay, fine, he's an ordinary layman, he wouldn't know things. No, he would know everything. So for every patient, you'll be given 15 minutes for patient encounter and 10 minutes for writing patient notes. So that's 25 minutes per patient. And you will be evaluated by the patient himself, right? So that is where the major component of your evaluation would come from. So you have to be nice to the patient, and you have to be to the point to ensure that the entire 15 minutes of the role play which happens goes in sync as per the requirements, right? Now when you're going to be inside the room, so on the right hand side of the screen, if you can see, this is you and there are 11 more students or doctors waiting for their cue. So there's going to be an announcement, your time starts now, and that's when you open up the small door. So there's a patient history which is given inside. You read through and then you knock the door, you get in, and that's when your 15 minutes would start. And during those 15 minutes, you would be assessed on these 3 parameters. That is the integrated clinical encounter, that is the ICE. Second is the CIS, or the communication and interpersonal skills. And thirdly, the SEP, or the spoken English proficiency, right? Now, in the integrated clinical encounter, it's all about patient diagnosis, okay? And all the skill sets that you have, you can show it to them. Now, Step 2 CS is considered the world's easiest exam. Right?
I didn't know that. Yeah.
But don't get very happy about things because it also comes with the highest failure rate. And the reason being is because of the second component, which is the CIS, also known as the communication and interpersonal skills. Okay. Largely, people, I mean, especially if I have to talk about my region where students, go to the US and appear for this exam.
Yeah.
They are well prepped with all the kind of cases which are required. But parallelly, Where they actually fail is the CIS, or the communication and interpersonal skills. Now we are coming from an Indian healthcare system. We
Mm-hmm.
are getting into or getting exposed to the US healthcare system. We do not know, how to talk, walk with those kind of patients. And then, if you just carry your mannerism with you, then that's gone. Which is why it is also recommended that before you appear for the step 2 CS exam, do a couple of months of clinical rotations, so then you get exposed to the US healthcare system, the patient management, life cycle of
Mm-hmm.
hospital,
Right.
electronic record keeping, everything. Because you might just say some you might just address the patient in a particular way, which is quite normal in this part of the world, but which could
Mm-hmm.
be offensive in the western part of the world. The
Right.
mannerism that they follow, what we follow, they are poles apart. So which is why you should not be doing this mistake of directly jumping into the step 2 CS exam before you are well adapted with the culture of that particular country, right? So CIS,
Right.
communication and interpersonal skills, because many a times, you know, you might just ask the patient, so when are you suffering from, or for how long? And he might say for 2 weeks since the time
Mm-hmm.
my wife died, or something like that.
Right.
And a basic sorry, even if you don't say, oh, I'm so sorry to hear that, or okay, I mean,
Right.
it's still a big thing. Even if he says my dog died, right?
Right.
You may not
Right.
like the dogs, but still you have to show that sympathy and empathy. That
Right.
is very important here, right? Even if you hate
Mm-hmm.
dogs, and even if you just say, "Oh, I love dogs," so that really
Right.
connects you well with the patient,
Mm-hmm.
and which is really missing, especially
Mm-hmm.
in our Indian setting, and that is what needs to be brushed up before you get into the CS exam, which is why CIS is the only danger factor here. Rest, I'm sure you guys will excel in the ICE and spoken English proficiency. I don't have any doubts on you guys, right? Recently,
Right.
I came across a case scenario where the student or the doctor there was not confident with the stethoscopes, and he was like just trying to figure out, and then
Mm-hmm.
the patient just lost his calm and he said, hold on, onto your right, stop, and now start. So these patients are trained to that an extent that they can also tell you if you're going wrong somewhere, they can also rectify you. So do not take your patients for granted, right? As of now, I'm
Right.
sure few of you or most of you may have heard, because of the COVID crisis, the Step 2 CS exams have been suspended for the next 12 to 18 months. We are yet
Yeah.
waiting for an update from ECFMG. The moment we have it, we'll be more than happy to share it with you, right? Doctors
Right.
pass all sections in order to obtain a pass, and the exams in the US can be given only in these 5 locations, which is Philadelphia, Atlanta, Chicago, Los Angeles, and Houston. Exam fee for the step to CS is 1,600 US dollars, and whenever you go to the US, you have to go compulsorily on a visitor's visa only.
Right. Thank you so much, sir. I think we learned a lot from this question. Like, I, for one, did not know that patients are the ones who evaluate you. It's very different from the Indian setup where it's always a doctor who's evaluating you. And I
Correct.
think now we'll all be sure to focus on our communication and interpersonal skills in regards to the Step 2 CS exam.
Right. So
Right.
while you are interacting with the patient in the image number 2 on the right hand of the screen,
Mm-hmm.
you have exact 15 minutes. And once you're done, you say, okay, fine, thank you so much, goodbye, whatever, take care. You step out of the room. Uh, there's going to be a closet there inside which there's going to be a computer, inside which there's going to be a checklist that the patient would have. And then the patient, and when you go out of the room, the last image on the right hand of the screen, if you can see, you are
Mm-hmm.
expected to type in the patient notes, whatever that you've interacted in those 15 minutes, you type in the next 10 minutes. While you're typing
Right.
in the patient notes in the next 10 minutes, the patient is busy inside, sealing your luck, whether you did it right or wrong or good or bad, whatever it is. So the patient
Right.
will get 10 minutes for evaluating you while you're out,
Mm-hmm.
and outside you sit and enter the patient notes and upgrade the system. So 15 plus 10, 25 minutes per patient is what you get times 12 patients. So roughly
Mm-hmm.
around 8 hours of the day is when you end up spending in the exam hall. So after 3 patients, you get a 15 minutes of a small break. After the sixth patient, you get a half an hour lunch break. And again, after the ninth patient, you get 15 minutes of maybe a tea break or something like that. So that's how 8 hours you are going to be there in the CS exam hall.
Right. Thank you, sir, so much for sharing this with us. We are now moving on to the next question. This is, is there a list of potential cases you can get for the Step 2 CS, or can any case come?
Well, first of all, any case can come. So I would recommend do not really, rely on a particular case or top frequently asked cases. Just about 2 minutes back, I told you, you guys are the best when it comes to case. You guys are the best when it comes to ICE. You guys are the best when it comes to SAP. Focus on the ICE. The CIS, the CIS, focus on the CIS, communication and interpersonal skills. That is exactly where we are lacking, and it's not your fault. It's the culture that we have been raised into, but we will have to adapt at some point in time. So rather than focusing on the frequently asked cases, focus on these skill sets. That is very important.
Right. Thank you, sir. So everyone remember, focus on your communication and interpersonal skills for this exam.
Right.
So the next question is, can you tell us, please, about the Step 3 USMLE format?
Sure. Now, the Step 3 exam does not come under ECFMG, as I must have told you in the previous webinars. So under the ECFMG, what they administer is a Step 1, Step 2 CK, and the last exam, that is the Step 2 CS exam, okay? My bad, I guess there's a heading says Step 2 CK, whereas it's Step 2 CS, okay. So in the Step 3 examination, it is administered by a different body, which is called as the FSMB, also known as the Federal State of Medical Board, right? So in the US, before you apply, you have to finalize as to which state do you want to settle down and practice and obtain a license. And then you will have to, through the FSMB, you'll have to, apply for Step 3 in that state only. So if you're applying for New York, you get a license for New York. So you apply through the FSMB, take up a Step 3, and eventually you will get a license of that particular state. Over a period of time, if you again wish to change your state, maybe from New York to California, California to Florida, whatever it is, you will have to again approach the medical board of that particular state and give an examination. So things are state-wise in the US, not like India, where it is like at a national level. Now, the Step 3 exam, unlike what we have seen so far in the Step 2 CK and the Step 1, where it's like an 8 hours exam and a 9 hours exam, but this time in the Step 3, it's a 2 days examination. So it's all about understanding the, it's all about the rapport building or the patient management, doctor-patient management. That's what the Step 3, deals with. It's all about the unsupervised practice of medicine. So it's all by yourself. It is a 2 days examination. On day 1, you go and attempt for 233 MCQ based questions. And on day 2, again, you go to the same exam hall and attempt the balance 180 question in the same setting. After the 180 MCQs are done, then it is time for you to attempt the 13 CCS. Now, what is a CCS? In a Step 2 CS, it's face-to-face patient and doctor. But here it is computer case simulation. So you will be given a simulator, and then on that simulator, you're supposed to, attempt to, do the patient interaction. And then depending on how you succeed, or rather in layman words, how many patients you kill and how many you save, you actually get the outcome of that. 196 is the minimum passing of Step 3, and exam fees is $830. Exam can be given only in the US, any state across the US. Like in Step 2 CS, we've seen you can give only at particular locations, that is Atlanta, Philadelphia, Chicago, Los Angeles, and Houston. But here across the US, you can give it anytime, 365 days minus the national holidays and Sundays. That's how the Step 3 is designed, for 2 days. Okay. One soother about Step 3 is, you don't need like a top score or a dashing score. Even a 196 is good for you, because you're eventually just going to get a license. You're not going to compete with someone. So 196 is equally good. Right, but don't aim at 196, otherwise you may fail. Just aim for a higher score. At least you get a 196. That should be sufficient.
Okay, thank you, sir. Now the next question is, can you show us a sample question?
Sure. So let's deal with the same tuberculosis patient this time in a step 3. So
Mm-hmm.
same patient comes to you, but this time the question changes and it says the patient is started on a 4-drug regimen in addition to the phenytoin he takes for his epilepsy. Which of the following should the patient be informed about? What would you inform the patient? What would you ask
Okay, guys.
to be careful about?
Okay, guys. Send in your answers on the chat. So I guess that what we're looking for is out of the 4 TB drugs, one causes an interaction with phenytoin. Okay. So guys, like send in whatever guesses you have. It's okay if it's totally wrong. I'm guessing that phenytoin is an enzyme inducer, and maybe that has an effect with has some kind of drugs. Anyone on the chat? Even if you're on YouTube, go ahead and send in your answers. Okay, someone has written rifampicin.
Mm-hmm.
Okay, they should be warned about rifampicin. Anything else? Someone has said streptomycin. Is it streptomycin? Okay, that's an answer. Someone has said isoniazid inhibits some of phenytoin. Okay, so it looks like, yeah, those are the answers which have been coming up.
Fine. So let me make your life a
Has been
little
coming
bit
up more often than
easier.
the rest.
Yeah. So let me make your life a little bit easier.
Okay. Okay, guys. So let's answer this question. Someone said that isoniazid inhibits phenytoin. So I guess that person would think the answer is B, increased chance of seizures. Anyone, any other idea? Yeah, okay. People are saying B, increased chance of seizures. Okay, let me check YouTube. Someone said abdominal pain, yelling of the skin. Okay. Okay, which is not one of these options. So I guess we will go with B, increased chance of seizures. Okay,
And that's
based on what most people
absolutely
said,
right.
yeah, people are now saying B.
Yes, that's absolutely right. So
Great
increased
job, everyone who said B.
seizures, that's
Yeah.
right. But in this case, a couple of things. One is, how would you, know and understand? Now, again, I wouldn't really expect an answer from the juniors, but the question may also change in a few scenarios. What if the question changes to, at what
Mhm.
site is the drug interaction happening? What do you think the answer could be? Where is the drug
Okay, guys.
interaction happening?
Okay, guys. The new question is, where is the drug interaction happening? Any answers?
No,
Zoom on YouTube.
yeah, it could
So,
be, if the question has to be twisted, it could be twisted to this extent. Where is the drug interaction happening?
where is the drug interaction? Okay. So someone has said something about enzymes previously. Would you guys like to elaborate? Where specifically?
See, the rifampicin and phenytoin are interacting and fighting with each other, but where
Mm-hmm.
is the question?
Any answers? Someone has said liver. Okay. Someone has said microsomal enzymes. Okay. Yeah, another person has said liver. Someone has said kidney. Okay, so these people are thinking how drugs are excreted, where drugs are metabolized. Yeah.
Okay.
Okay. Liver, people are saying liver, I think, mostly.
Okay. So the right answer is cytochrome P450. Okay. So
Mm-hmm.
the point I'm trying to make here is, we have seen the same tuberculosis guy, right from where the step 1 question was to where the CK question went up to, and now what is the step 3 asking him, right? Now,
Right.
even if you forget about, you cracking, not cracking, even if you study this particular patient in this kind of condition, I'm sure you're going to be the next best doctor of the country, because you actually know to this kind of in-depth information about this particular case. So this is the basic
Mm-hmm.
difference between what we study in MBBS and what actually USMLE makes us do. So that's all about
Right.
step 3 as well.
Great. So now we have a few more questions, just general questions. Someone has asked, if someone has not traveled to the USA as of yet, what are the of acquiring a visa? Will there be some kind of problem in applying for a visa?
Well, not really. I mean, if you've not traveled to the US, that's absolutely fine. There's always a first time, and it could be you. So when you go to the US, you definitely go to the US for one of the various reasons. One, it could be the attempt the CS exam, or it could be doing rotations, or
Right.
it could be anything. So you can always attempt and apply for a B1 B2 visa, because that's the only thing which is required, and
Right.
you're free to go.
So the next question is related again. From the first day of his preparation till the time he gets his residency, how many times and what kind of visas will he need?
Well, again, as we just said, I guess it's a duplicate of the question, but maybe in a different question. No problem. I'll just answer this. So, in the entire journey of USMLE, you will have to visit US on different occasions. One is for your step to CS, which has to be done compulsorily on a B1, B2 visitor's visa. The second time is the electives or rotations or clerkship or whatever ship. It is again on a B1, B2 visa only. There's no other visa that is available for you to do your rotations in the US. The third time is when you go to the US for the step 3 examination, right? That is again done on a B1, B2 visa, which is again a visitor's visa. Lastly, when you go to the US, that would be for the interviews with the program directors. So that is equally on a B1, B2 visa. So I would recommend and urge all the students to apply for a B1, B2 visa, multiple entries, which is valid for good 10 years. So just take it once and keep it with you. It's not going to cost you much, and it's always good to have rather than running around at the last time. Like for example, if someone's trying to apply for a visa now who couldn't do it earlier, and this pandemic, no one is going to give you a visa. So it's always good. You cannot anticipate what's going to happen. It's always good to have a 10 years visa with you. You can, the moment the travel restrictions are lifted, you can always travel to the US. But again, I named a few occasions where the B1, B2 visa is applicable. Does that mean that you have to travel so many times? If you're smart, you can club things together. So in one trip, if you plan to go for 6 months, let's say you've got some relatives there and you can stay for a longer period, why not go to the US, do your 2 or 3 months of rotations, followed by finish up with your step to CS examination. Parallelly, assuming if you were already started with the step 3 preparations, right? Then maybe once your ECFMG certification is done, you can immediately write your step 3 examinations and come back. So in one trip, everything is done, rather than going to the US twice or thrice or maybe even 4 times. And then later on, once again, you will have to go to the US for your for interviews. So again, that is going to be on your B1, B2 visa. After you've completed all the process and you've got a residency, then depending on what visa type that you've applied, J1 or H1, then you come back and then you change your visa status and you apply for it before you fly down for your actual residence in the US. So only 2 visas in the entire duration you will have to fight for. One is the B1 and the other one is J1 or H1, depending on the residency. In the meanwhile, if someone is interested to go to the US and stay there for good 2 long years, right? So in that case, you don't have to apply for so many visas, because with Kaplan we definitely help the students with the F1 visa, which is a student's visa. So Kaplan is authorized to issue the F1 visa letter, which is called as the I-20. So basis this I-20, you can go to the embassy and file for a student visa. So if you are going to the US, stay there, and you have the status of F1 student visa, and under the protection of F1 visa, you can finish your step 1, step 2 CS preparation. You can finish the clerkship or any other US clinical rotations under the same visa. And if luck permits, if you have time left, you can finish off with your step 3 and then come back. So you need not have so many visas that you can apply. So there are a lot many ways we can think of of sending a student to the US, right? Again, I don't want to get into the details of it right now, but if anyone still has any questions or doubts on this particular topic, you can just get in touch with me offline. I will explain you the various ways and backdoor entries that you can get into the US.
Okay, thank you, sir. So now we'll ask our final and last question, which is Kaplan is the first choice for USMLE admission. How can Kaplan help students prepare for the USMLE?
All right. So definitely, yes, the synonym to USMLE is Kaplan. Those last 40 years, Kaplan has been delivering consistently with the top-notch faculties across, and people across the world are coming down to the US, staying in the US. As I was just referring to the F1 visa, people stay there. They take the live lectures there. At times, they give the exam in the US itself, finish everything, finish the rotation, CS, CK, everything, and then they come back to India. So that also happens. Now, why Kaplan? Because Kaplan has the world's greatest faculty. All our faculty members are currently teaching in some or the other university in the US. So you are not aloof from those best professors or faculty members. The same faculty members who are teaching the US candidates are also teaching our candidates, right? So you get exposed to the best faculties that you can ever have when it comes to Kaplan. With Kaplan, there are two types of programs. One is sit at home and study if you're in India or Asia somewhere. So that can suit your time, time zone difference, etc. And the other is in person, where you go to the US, stay in the US, and do the live classroom lectures, as you can see in the image on the right side of the screen. The online study options that we have will cater to 4 products, which is the on-demand. On-demand will fetch you with the recorded videos of the faculty members, the question bank with all the upgraded questions, up-to-date Q bank with more than 2,000 plus exam-like questions. It will give you the book sets of 2020 and different types of tests is what the on-demand would fetch you with. The second type of program that we have is the live online. Live online is nothing but the combination of on-demand plus the live online lectures. So in the live online, you get the live online lectures, you get the recorded videos, question bank, books and tests, just which is the on-demand plus the live online, right? The best part about live online is all the live online lectures are catered as per the Indian timings. Previously, like 2-3 years ago, the timings were like 3 o'clock in the morning, but now the timings are 7 p.m. Indian time to 11 p.m. Indian time. So like 7 to 11 evening hours is what the timings are. Then you also have the question banks separately. If you do not want a clutter, you just want a separate Q bank, we have a Q bank. And there's an upgraded version of Q bank, which is called as the integrated Q bank. I'll just explain you all these 4. So these are the resources: lecture notes, question bank, or the on-demand videos, diagnostic test, assessment test, full length 7 hours exam. Now, you've studied everything, but are you able to get the score? Maybe yes, maybe no. But what factor would it decide? If you're taking a 3 hours test and if you're getting a great score like a 95 plus, it really doesn't make any sense, because the real USMLE exam is an 8-hour long pattern. Take a 8-hour long test and then check the scores. If the scores sustain, that's great. 95% of the times it will drop down to maybe as low or as high as 60-65%. The reason being, you've trained yourself on the questions and the pattern and the type, but you've not trained yourself on the physical aspect. It's a strenuous thing to sit at one place for 8 long hours. And it's not just like sitting and chatting with someone, but like, your brain has to function at the optimum level to minute. So is your body tuned and trained to that aspect? That is very important for you to know. So that is why we give you full length exam. That is a 7-hour pattern exam for you to check where do you stand. At any given point in time, previous webinars also I told you 240 to 50 plus is what you should be aiming at. And then you get a Q bank which assesses your strengths, weaknesses. It gives you access to thousands of questions that Kaplan has to offer you. These are the book sets that Kaplan offers you for step 1, CK, and step 3 respectively. All updated lecture notes, which is the physical copy of textbooks. This is a snapshot of the on-demand videos. So these are pre-recorded. You can watch them again and again and again, rewind forward, whatever. So this particular topic that Dr. David is delivering on is all about the gonad development. This is exactly how your screen would look like when you're taking the live online lectures, where the live faculty you can see on the left side of the screen is live and online. In the live setting, you can ask him questions, doubts, whatever he's trying to teach you. You actually understand. If you've not understood, you can stop him, ask him questions, ask him to repeat. All of that definitely does happen in the live online setting that the Kaplan has to offer you. This is the overview of the online portal that the Kaplan has to offer. So you have on the left-hand side QBank. If I'm doing anatomy, under anatomy, I've got embryo, histo, gross anat, neuroscience, clinical correlates, and assessment. And on the right-hand side, I've got some video lectures. I've got some quizzes after every video that I watch. So immediately there itself, I understand my strength and my weaknesses. Is there a need to repeat a particular video, etc.? That's how this assesses you, right? If I'm trying to take a question bank or test on question bank, I have the option of customizing. So there are checkboxes. I will just check whatever topics I want, and then I make a customized test of my own. And then I can also, I have the freedom of using either the fresh unused questions or the correct previously used questions or the incorrect questions of the previous questions, previous sets, etc. All of this. And then I can also choose the difficulty level. Do I want only the easy questions or the medium or the tough questions? That's how I can customize the entire QBank and then make a test of my own and then give it. So that's the great feature that Kaplan has to offer you. Once
So
you
thank you so much for sharing this with us. And we are going to send your contact information to everyone in all of the USMLE groups, so that if anyone has any more questions or they want to know more about Kaplan and all the things which you have mentioned, we will give them the opportunity to do that. It looks like we're running a little bit short of time today. So I think if it's okay with you, sir, that we'll end this session on this note.
Sure.
Thank you so
Before I
much.
go, I just have one last
Yes,
slide
sir.
to share with all my
Sure, sir.
viewers. Um just give me one moment.
Mhm.
I just need less than like 2 minutes if you're okay with
No
it.
problem. Yes, sir.
Yeah. So this is the free study resources for medical students that Kaplan is giving for free to all, even the organizers and viewers. I would urge all of you to take a screenshot of this. Go to this link bit.ly/free prep LQ after the end of this session, so that you can have access for these free resources for 12 months. No kidding, it's absolutely free. So you can just go for these resources right after this particular session, right? And I'm available on Quora because this is the last webinar series. I just want to drop down my contact details after this. If you think that you still have some questions, you can just follow me on Quora, because there's a lot of questions that I've answered for the questions for the students for USMLEs. We're also running a 10% extra discount of Kaplan courses. If anyone is interested, you can always get in touch with one of our crew members in one of the closest cities that we have, and these are my contact details. So having said that, I guess that was good, and that's the end of the session for the day.
Okay, so that was the very last question in the very last episode of our webinar series. On behalf of all of AMSA India and all of our viewers here today, thank you, sir, so much for taking the time to share all of this with us. It was so helpful and I learned so much. And thank you for all the free resources which you've listed here. We're going to circulate this PowerPoint amongst through all the USMLE WhatsApp groups so you guys can access them. And like Mr. Abhishek said, you guys can just contact him directly if you guys have any more questions. And now to our loyal viewers, thank you guys so much for staying with us through all of these sessions. And we hope that these sessions have helped you out a bit and answered some of your questions about the USMLE. We're not able to answer all the questions because of the time constraint. But again, if you have any more, feel free to reach out to Mr. Abhishek, or you can email him and you can contact him with any of your doubts. And you can always contact us directly at amsaindiaexternal@gmail.com. Stay tuned. See you all again soon. Goodbye. Stay, wash your hands, clean your phone, and maintain social distance. Bye.
Thank you. Bye-bye.
Thank you.